Hi, I'm Jennifer Stewart and I'm going to talk to you today about the importance of calcium and phosphorus in horses' diets and how the pasture affects that. It's generally widely accepted now that high oxalate pastures are associated with a generalised osteoporosis in horses. We call this big head, or there's other names for it, big long names, but basically it's an osteoporosis. And the reason it occurs from pasture is because the calcium in the pasture is bound or chelated to a chemical called oxalate, and that forms calcium oxalate, and it's insoluble in the horse's gut. So it's akin to us eating a rock and thinking we'll be able to get zinc and copper and other minerals from the rock, when in actual fact it's going to pass out in the manure. It's exactly the same with calcium oxalate in the horses. This is at a microscopic level, but this is what's happening. It's passing straight through the horse's gut. So in effect, even if we measure the amount of calcium in the plant, it will look like it's going to meet the horse's requirements. The problem is it's going straight through the horse, and it comes out in the urine or the manure, but it's not being taken up into the bones and absorbed where it's needed. So when we get a problem in the calcium to phosphorus ratio, the calcium's always got to be a certain amount more than phosphorus, because that's the ratio in the body and in the bones. We get movement of calcium out of the bones to try and keep the blood levels in the tightly regulated range that's essential for life itself. So there are other things that can affect the calcium phosphorus intake and ratio in the horse's diet. The other one we're talking about in the oxalate pastures, basically the calcium level is low, and remember we want it slightly above the phosphorus level. And unfortunately the amount of oxalate in the pasture will vary with the season, the amount of fertilizer, the stage of growth of the plants, the age of the plants, the species of subtropical pasture. So it varies a lot, and we've done some research in measuring it, but it's such a random thing that we can't accurately predict which horses are going to be at risk. And the other interesting thing is that we can see it in horses that have moved interstate, and we're getting quite a lot of reports of this now from veterinarians and owners who are interstate. The horses are not on oxalate pastures, but they're showing signs of osteoporosis or big head or shifting lamenesses. And the reason is that once the horse has been on oxalate pastures for any length of time and the calcium levels has been down and they've been drawing calcium out of their bones, it can take up to 12 months to remineralise the skeleton. So the horse can certainly still have big head and osteoporosis even if it's not currently on oxalate pastures. The other dietary situation which has caused big head and osteoporosis is when the calcium's fine, but the phosphorus is high. So remember, the subtropical pastures, we lose calcium, they're too low. The other problem is when the diet's high in phosphorus, and that can occur in any grain-based feeds or mill-run byproducts like bran, pollard, plus grains, white chaff, oat chaff, wheaten chaff, native pastures. Most grasses are high in phosphorus and low in calcium. So if their diet has been predominantly grain or white chaff, white roughage based, then you can have a gradual situation of low blood calcium developing, and certainly horses, racehorses, leisure horses, horses in freezing cold places like North America, and horses in hot places like Hong Kong, and have all been reported to have this problem, which is clinically osteoporosis, big head, shifting lamenesses, dental problems, etc. But it's associated with a high phosphorus intake.